HNA to IHC virtual staining looks like a standard image-to-image translation problem, but for HER2 scoring, it is really not. In clinical practice, HER2 assessment depends on two very specific factors: how many carcinoma cells are present, reflected by nuclear distribution, and how strongly the cell membranes are stained, reflected by DAB intensity. If either of these is wrong, the image may look realistic but becomes clinically useless. The key idea here is to explicitly force the model to preserve these diagnostic cues instead of optimizing only visual similarity. The first step is extracting task-specific information from real IHC images. Using color deconvolution in HED space, the hematoxylin channel is used to represent nuclei, while the DAP channel represents HER2 membrane staining. From the hematoxylin channel, nuclear centroids are detected and converted into a smooth nuclear density map. From DAP channel, here, a membrane staining intensity mask is obtained using simple color thresholding. Training happens in two stages. In the first stage, a nuclear density estimator is trained. This network learns to predict nuclear density maps from high-level encoder features of real IHC images. This step is crucial because nuclear extraction through color operations is non-differentiable. Without this estimator, nuclear information cannot be used to guide a generator through backpropagation. In the second stage, a conditional GAN is trained with two auxiliary constraints. The first is nuclear density regularization. Generated IHC images are passed to the frozen density estimator and predicted nuclear density is supposed to match the real nuclear density map. This directly enforces cell-level structural consistency even when H&E and IHC images are not perfectly aligned. The second constraint is membrane staining enhancement. Here the H&E image is masked using the membrane staining intensity mask and passed through the generator. The output is supervised against the real DAB channel using an L1 loss. This explicitly pushes the model to focus on HER2 membrane expression strength instead of spreading capacity over irrelevant tissue textures. The final objective combines the adversarial loss of the generative adversarial network or GAN, L1 reconstruction loss, nuclear density regularization to make sure that the nuclear density matches the real nuclear density, and membrane staining enhancement, balancing realism with diagnostic fidelity.